So, hello again. My name is Janine Kirby, and I'm the chairperson of MISA. And I'm really delighted to be welcoming so many of you from both South Africa and also from further into Africa. And it's really lovely to have the sense of our really wider Southern African or African community that's going to be represented here this evening. Um, we're really looking forward to this evening. We've got three great speakers. So we have Dr. Pete Milligan. Pete is a psychiatrist and he's working in northern KwaZulu-Natal, where he's involved in the development of mental health services in underserved rural areas. And he has got a particular interest in mindfulness-based interventions for healthcare workers. And then welcome Samba. Samba is in Botswana, and Samba is a GP, and she's got a specific interest in lifestyle medicine and diabetes prevention, and in a whole number of other things like digital therapeutics for anxiety, overeating, smoking cessation. And then welcome also to Elizabeth. Elizabeth, I think that you are in Kenya, yes, at the moment. So it really does feel like this is our Pan-African meeting this evening. And Elizabeth is a former barrister and has worked in international human rights and is very interested in mindfulness, specifically in the treatment of addiction, and is currently studying to become a fully accredited addiction counselor and therapist. So thank you to everybody for actually all the work that you've done for putting together this evening that we're all very excited to hear about. So just to let you know, we'll have about 20 minutes when Pete will talk about the neuroscience of addiction, and that will be followed by a conversation between Elizabeth and Samba, talking about personal story of addiction. And then the third 20 minutes will be where Samba's just going to give us a little bit more information about mindfulness-based initiatives that are available for addiction, and leaving us at the end some time for questions and answers, because I see not only do we have very rich panel, we've got some really interesting people that are joining us for this session. So thank you to all of you, and over to you, Pete.
Thanks, Janine, and good evening, everybody. Nice to see so many familiar faces and some I haven't had contact with for a very long time. So greetings from warm Zululand and rural KZN. I'm just going to share my screen. Okay, so I've been asked to talk a little bit about the neuroscience of addiction, and also to say something about the evidence for mindfulness-based interventions in addiction. So I'm going to fly through what is really a very short summary of the topic given the time available. So it's been suggested that perhaps the most helpful way to think about addiction is to use the illness or disease model of addiction. So that addiction is a chronic and relapsing brain illness, and in that sense no different to other chronic medical illnesses like diabetes or hypertension or heart disease. And that addiction is not a result of personal weakness or choice, but rather a biological and a medical condition. And the value of this model is it emphasizes the role of genetics, of brain structure and function in addiction. Let me say it's not without its critique, but I think that it's a useful model, and particularly in that I think it helps those of us working in addiction to shift away from any kind of blame of the person living with addiction, to a more understanding sense of a chronic condition and a chronic illness. So I'm going to talk a little bit about the neurophysiology, and really there are three critical brain areas involved in our understanding of the pathophysiology of addiction. The first area is the basal ganglia that are mainly concerned with binging and intoxication. The second area is the extended amygdala, which are involved with withdrawal states and the negative affect or emotion associated with those withdrawal states. And then the prefrontal cortex, which is fundamentally concerned with cognitive function and what we call executive function, so involved with preoccupation with substances, the craving and the anticipation of substance use. So just to flesh that out briefly a little bit more, so we're starting with the purple area, the basal ganglia, and talk a little bit about binge and intoxication. And it's in this area, the basal ganglia, that the reward system is situated. And here we feel or experience the rewards of substance use. And these areas are also responsible for the formation of habitual substance taking. And this is where the so-called reward circuits, or some people call them pleasure pathways, end. And substances or drugs overstimulate this circuit, thus producing the euphoria of the drug high. And ultimately, this is regarded as the final common pathway, whatever drug is being used, and in fact, in all pleasurable activities that may lead to addiction, not just addiction to substances. However, with a repeated stimuli and repeated exposure, there's an adaptation that takes place in this circuit, diminishing its sensitivity and making it harder to feel pleasure from anything besides the drug of abuse. The second area is the extended amygdala, and this area is more associated with the withdrawal features and the negative affect or negative emotion that addicts feel in withdrawal. The extended amygdala are involved in stress and the feelings of unease, anxiety, irritability that typically accompany substance withdrawal. And these areas with extended use become increasingly sensitive over time. And ultimately, there's a shift from using the substance for the high or the intoxication effect to rather using the substance to get relief from the negative affect and discomfort that is generated by withdrawal. And then the third area is the prefrontal cortex. I mentioned earlier that this is involved with executive function, really top-down control of the other structures that I've mentioned already, including exerting control over substance taking. And what happens with addiction is there's a shift in the balance between this circuit and the two circuits that I've already mentioned. And this makes a person with a substance use disorder seek the drug compulsively and with reduced impulse control. But it's also the prefrontal cortex, and in particular the mindfulness practice, that can help to strengthen the top-down regulation of the prefrontal cortex, which can be helpful. Another concept that I think is helpful is thinking about substance use as self-medication. So I always ask, what could this person be self-medicating through the use of substances? And if we think about it for ourselves, whether it's food or substance or whatever our various self-medication choices are, we all do this in some way. So individuals may use substances to counteract the effects of other medications, to reduce anxiety, or simply, as I've said, to cope with these negative withdrawal symptoms. They may also be self-medicating underlying depression, a range of anxiety disorders, post-traumatic stress disorder, and may be using substance as a way to manage or self-medicate their symptoms. And we know also that people with physical ailments, and particularly with chronic pain, may also self-medicate with substances to alleviate pain or discomfort. So what are the possible mechanisms for mindfulness-based interventions in addiction? And I'm going to suggest 4 from the literature. The first is that mindfulness can help people become more aware of their cravings and habits around substance use, and it also helps them to notice the triggers and urges more clearly. And that gives the individual a little bit of breathing space and a chance to break the cycle of negative thoughts and reactions by using healthier or alternative coping mechanisms. The second is that mindfulness can help people to shift their focus away from things that remind them of using substances and reduce their tendency to pay extra attention to these reminders. So helping people to shift away from their preoccupation with the substance or their craving for the substance. The third is that mindfulness practice could help individuals to become desensitized to distressing experiences. So these distressing experiences that I was talking about earlier that trigger substance misuse, if mindfulness can help one become desensitized to, and then the individual can reorientate their attention to the sensation of breathing or other health-promoting stimuli. And lastly, as is well established, mindfulness training could enhance stress management and reduce stress-precipitated substance use. So those are 4 possible mechanisms as to why MBIs may be useful and why these therapies have been used for at least 2 decades now in addiction. So what are the MBIs for addictions? And there are many of them. I've just highlighted the most published ones. The first was a modification of mindfulness-based stress reduction, which was the work of Davis, Fleming and co., going back to 2007. And that was followed shortly afterwards by Bowen's work on mindfulness-based relapse prevention, which I think probably many of us are aware of. And then Garland's work on mindfulness-orientated recovery enhancement came in about 2014. But let me say that there are a whole range of variants out there. So people based on their own experience or training have modified in different ways a basic 8-week MBSR or perhaps a mindfulness-based cognitive therapy program, but also dialectical behavioral therapy, DBT, has been used and modified for addiction, as has acceptance and commitment therapy in a similar way. And there are a number of others. So in the last 5 minutes or so, I want to just talk a little bit about the evidence. And again, it's impossible in this short time frame to really give you a complete overview of the evidence. What I do want to say is that the evidence is mixed. So I'm going to start by presenting one of the earlier systematic reviews, just to give you a sense of how this work is done and what those results were. And this systematic review was in fact very positive. Then there's a kind of more muted review showing that mindfulness-based therapies are probably at least as good as the other known effective therapies. But I'm going to finish with another review that suggests they may not be as effective. I think this is important because I don't think we must come away from this evening with a sense that mindfulness is a panacea or that mindfulness is the cure for all addictions. So this is a systematic review and meta-analysis from as far back as 2017 by Lee et al. And they, as they do in these systematic reviews, do a literature search, look for multiple studies, assess their eligibility for inclusion. There were over 400 studies that they looked at, and in the end ended up with about 40 studies that they thought could be included in the review. 34 of those were randomized controlled trials and 8 were quasi-experimental models. 33 collected original data, 9 were using secondary data from other studies or other projects. The sample size ranged between 24 to 459. There was 1 adolescent study, 5 studies included women only and 4 men only, and interestingly 7 were conducted in the criminal justice environment or in the prison systems. There were a range of interventions studied in this systematic review, so some of which I've already mentioned. I'm not going to go through this whole list in the interests of time, but you can see some of the challenges of doing these systematic reviews when different methodologies are being used. And it's quite a challenge to then pool the data and come up with a meaningful systematic review and meta-analysis. So what did they find? Well, you may smile at this, but the first thing they found is that mindfulness treatment significantly increased mindfulness. And before you laugh at that, this is really important because we have to show that the mindfulness intervention we are doing improves mindfulness before we can say that mindfulness helps with addiction. So this is really important in any study of this nature. We have to demonstrate that what we're doing not only helps with addiction, but improves mindfulness. So they concluded that there were improvements in mindfulness, emotion regulation, attentional control, importantly, self-efficacy to refuse substance use, and overall self-control capacity. The other secondary outcomes were that the treatments were superior in reducing psychiatric distress and negative affective states or negative emotional states, in reducing stress, dissociative experiences. Those are out-of-body or other dissociative experiences that are commonly experienced in substance use. For patients with chronic pain, reducing pain severity, and importantly in reducing functional impairment. Other secondary effects was there was an association, positive association, between the amount of mindfulness practice and abstinence from cigarette smoking. The amount of mindfulness practice was also significantly negatively associated with the amount of cigarette smoking. In other words, the more mindfulness practice, the less cigarette smoking, the less cannabis or marijuana use, and lower levels of alcohol consumption. And changes in mindfulness significantly mediated the effects of mindfulness treatment on changes in craving and also post-traumatic stress symptoms. Looking at the effects, the primary effects on substance misuse, this review concluded that these treatments are superior to control conditions. So treatment as usual is TAU, relapse prevention treatment, cognitive behavioral therapy, and active support groups in the following areas. They were superior in reducing frequency and the amount of alcohol and drug use, superior in the number of alcohol and drug-related problems, and also superior in reducing the level of craving for substance use, and importantly, in increasing abstinence rates. So really good news for mindfulness-based interventions and addiction. But the picture is not always as positive as this. So I want to take you to two more recent reviews. Let me just finish this one. So in summary, this meta-analysis showed significant small to large. In other words, the effect sizes of these were not always large, but they were there, in reducing the frequency and severity of substance misuse, the intensity of craving for substances, and the severity of stress. So moving on to two other meta-analyses, and here I'm just going to present the summary conclusion in the interests of time. So this is a 2020 systematic review, but this time specifically of manualized treatments. And some of the manualized treatments include modified MBSR, mindfulness-based relapse prevention as well. And here they concluded that MBIs appear to be as effective as existing evidence-based treatments for substance use disorders, and specifically at reducing the frequency and quantity of alcohol and drug use, of reducing substance-related problems, craving for substance use, and at increasing the rate of abstinence. So you can see here we're starting to compare MBIs with other evidence-based interventions. And this is important in clinical trials, that we don't just look at whether treatments are effective on their own, but how they fare head-to-head against other known effective treatments. And this suggests that they're probably at least as effective. And then the last meta-analysis I want to present is in fact a Cochrane review. So those of you who are in the medical field will be very familiar with the Cochrane collaboration. And the Cochrane is really the gold standard in evidence-based medicine. This was a study published in 2021. Again, they looked at least 40 different MBI studies for addiction, and their conclusion is much, much more modest. And this is partly because in the Cochrane review, the standards are much higher in terms of the methodology used in the research. So they're much more rigorous in looking at the quality of the research as opposed to just looking at the outcomes. And what they did in these 40 plus studies is they looked at a couple of key points in terms of outcomes. First of all, directly following completion of the mindfulness-based intervention, and then at a follow-up time point, which in the various studies ranged from 3 months after completion to 10 months after completion. And this is really important because we can't just measure outcomes at the end of the intervention. We need to ask ourselves, are the benefits sustained for patients? And their conclusion was that relative to other interventions, standard of care, CBT, psychoeducation, support group, physical exercise, and medication, that MBIs may slightly reduce days without substance use. So that was, if you like, the one positive finding. So reduced days of substance use simply means that those in the study using substances exposed to MBIs would use substances less than the others. But for other outcomes, they concluded that it's very uncertain whether they reduce other substance-related disorder or substance use disorder-related outcomes. And so while, excuse the pun, that may feel a bit sobering, I think it's just important that we recognize that there's still ongoing work needed in this area, particularly around the quality of the research, in order to really determine what works and what is less effective. So thank you very much, Janine. I'm going to finish there. Thank you.
Thanks, Pete. As you say, somewhat sobering. I'm now going to hand over to Samba and Elizabeth, where they're going to be in conversation talking about a personal journey with addiction. So over to the two of you.
Thanks, Jenny. And thank you, Pete. Over to you, Elizabeth.
Thank you. Thank you so much, Pete, for that lovely presentation. Sobering, but still enlightening as well. Thank you. And we've already been introduced by Janine, but let me reiterate that this is going to be a conversation rather than strictly an interview, but I'll be sitting talking Samba through her personal journey, through the minefield of addiction, and with courage and resilience, how she has managed to pull through those mines and made her way out to on the road of recovery. So this evening, Samba's going to take us on that journey of exploration for her personal feelings, attitudes, the challenges, and how and when mindfulness came in as part of that heroic journey, if I may say so. And let us know. So I'll start off with asking you, Samba, what happened? What was it like, and what is it like now? When did it all start? Thank you.
Thank you, Elizabeth, and thank you, everybody, again for being here and for giving me this chance to share a bit of my story. Hopefully, it can be of encouragement to others. I have no idea where it started, so to speak, but I just knew growing up that there was always a lot of fear and anxiety that used to be part of me. And since there was always a lot of drinking alcohol in the house, the adults drank. When I got to taste that, I realized I felt different. Those fears and those anxieties disappeared. And I guess that's just what about set me off. I do not blame my parents for their upbringing. I'm very grateful for all that they gave me. But there was a lot of drinking, and the adults would get very unruly, and there'd be a lot of fighting and all that. And I remember being terrified, being scared, and also feeling like nobody was listening to me, because when they start their fights, it's like you were not there. You just didn't exist because they were just caught up in whatever, bless their hearts. Anyway, so when I started drinking, I realized I felt different. And I'm not blaming my parents, as I say, because we were many of us and we didn't get into trouble with alcohol. And in time, because I just loved the way I felt when I'd had something, that fear, anxiety went away. It became just a way of, I guess, as Peter was saying, self-medicating. Of course, I didn't know that's what it was. But then it just became a part of my life, and because it was acceptable, and I remember, as small as I was, with the small size of mine, I could actually drink a lot and not get drunk like other people. So that made me a champion, that made me a hero in a way. And I didn't understand at that time that that is what was setting me up to become in trouble with alcohol. So, and in time, as the years were going by, the drinking would just become, I would drink more than I intended to, because I never intended to drink to get drunk. That was never my intention. I just wanted to feel okay, to take the edge away, to feel less fear. But in time, I didn't understand it then, but I'd crossed that line. And once I started to drink, I couldn't stop. I always overdrank, and I always drank more than I intended to drink. And yeah, so that's how I got into trouble with the alcohol.
Thank you very much, Samba, for giving us that picture where alcohol was normalized in your home. And I think it's interesting from the sort of scientific perspective that Peter has already drawn us to, that it's a brain disease. And when one starts drinking, perhaps at a young age, certainly below the age of 12, that this already starts damaging a brain that is not yet fully formed, perhaps until we're 23, 24 years of age. So that's something to bear in mind. Adverse childhood experiences, that fear that you were repressing and wanting to feel good. For you, alcohol was the solution. That was the medicine, I guess. Would I be right in assuming that?
Yeah, that was my friend. Yeah.
Yes, alcohol was your friend until it wasn't.
Yes, because in time now, as I said, I started to drink more than I really intended to drink. And then I would forget to do the things I had promised to do. My personality, my behavior would change. I'd become very aggressive, fighting, a lot of anger, because that fear used to come out as anger, because I didn't realize it then, but instead of feeling fear, then it would just come out as anger, explosion, that sort of thing, which would be worse when I'd been drinking. And I didn't want to feel that way, but I didn't know how to feel normal without having a little bit of alcohol in me. And in time, I was just getting into more and more trouble with my drinking, especially in terms of my relationships, etc. And I was in a lot of emotional pain over the years. I was in a lot of pain because I didn't like to feel that way. I didn't like to be so. I felt useless, hopeless, just could not keep my promises, behaved contrary to the way I wanted to be. But I just didn't know how to be different. And I remember I was depressed, and good friends took me to see psychiatrists and psychologists who prescribed antidepressants, and I drank on top of the antidepressant. And and I always, when I was asked how much to drink, it was never more than 2 drinks. I never drank more than 2 drinks. That's what I always said. But it was, of course, far more than that. But I was, towards the end, so depressed, so suicidal. I thought of ending my life, taking an overdose. I just didn't have the courage to. But I was in a lot of emotional pain. I just didn't want to be at that place, and I didn't know how to be different.
Yes, and I assume that as time went on, that you needed more and more alcohol to get to a point where you felt that sense of normality, sanity, serenity, feeling that that you were not alone and that you could cope. So this was a form of maladjustive coping mechanism.
Yeah.
And when you built up that level of tolerance, There's that, what is called chasing the scream. You need more and more to get to that point of satisfaction or gratification. But then the vicious cycle starts, because as Peter, I think, has already pointed out, that alcoholics we will try to alleviate the distress that comes from withdrawal.
Mhm.
So even if we try to stop or try to slow down, I'm only going to have 2 drinks, really. But the effects of that withdrawal are worse than the drinking. So there again, it becomes that vicious cycle. So how did you get out of it? And
Yeah,
was
yeah.
it mindfulness?
That's true. Because really, as Pete was saying, start to drink more to take away that uncomfortable feeling, the restless, irritable, discontent feeling that would always be there by just taking 1 or 2 drinks, which was always my intention. Okay, well, I was, as much as I'm a medical person and I was working in the medical field, I had no understanding about my own disease, none at all. And I say this because maybe there are out there other healthcare workers, professionals who may be struggling just like me and need to know that, this is something that can happen to all of us. But some good people recognized that I wasn't a useless, hopeless person, but I was a sick person, and they shipped me off to rehab. And from Francistown, where I lived there, the nearest rehab was Johannesburg, in fact, Boksburg, where I am right now. And that was the most terrifying time of my life, because it was just before the new millennium, November 1999. And I had not been sober for many, many New Years. New Year's didn't see me sober at all. And everybody was excited. I thought, oh my God, I'm going to, but I didn't want to feel that way anymore. I was desperate enough that I just wanted to feel different. And if they said, you need to do something different, I would have just said, what do I need to do? Which is what I said. So when I got to rehab there, they told me that I was a sick person. I wasn't a useless person. So then I began to understand that I was sick and this disease had symptoms or whatever. And I was introduced to a 12-step program, etc., which just then changed my life altogether. And from then, going back to Francistown, I didn't know anybody sober except what I call the boring people. They were loving, but I call them boring. They were loving. I love people. But anyway, they told me just do things differently. So, and they said, if you believe God has a higher power, just stay sober for the next person who needs to know there's a way out. So I think for the first time, I was being asked to look out for other people instead of looking, what did I want? How did I want things to be? How. And so I got online and found, we didn't have Skype or anything, but I found whatever other AA groups in other places and other 12-step thing, other places, and I got connected. And I started working the program. And then after some years, I started working this 12-step program. I got in touch with other 12-step program people nearby, and life then just was so different. But I never looked back, because I was given new tools and a new way of looking at things. And I think for me, the biggest relief was actually coming to understand my feelings. Because before recovery, I just knew I had a yucky feeling. And if I took a drink, the yucky feeling went away. I didn't know if I was sad, if I was angry, was I lonely, was I tired, was I disappointed? I didn't know how to process all those things. I just knew it was a feeling I didn't like. And if I took a drink, I didn't have to feel that feeling. So that's part of the greatest gifts that I've received in recovery, being able to know and to be with my feelings.
Yes. Yes. So you were a willing customer. You went willingly into rehab. Many of us have had to be dragged in, screaming and shouting, but as it said in AA, you were probably sick and tired of being sick and tired. You'd reached your rock bottom and you surrendered to the fact that, look, I can't do this on my own. I need the support of a program. I need the support of, as you mentioned, a higher power that can bring me to sanity, some form of sanity. Getting in touch with your feelings. It's quite difficult, isn't it? I remember my own experience when I saw a therapist, and whenever she asked me, well, how are you this morning, Elizabeth? And I'd say, oh, I'm fine, until she brought a wall chart full of emojis. And emojis were not very well known back in the day. And she said, well, you've got to point out which one is closest to how you're feeling now. And that was an astonishing exercise because of the nuances between all the various little faces. And I had to pick the exact one that matched what was going on inside. But I didn't have the words. I didn't have the vocabulary. And I can understand, I can resonate with what you're saying, Samba. So you took the AA route. How did mindfulness come in?
Hey, thanks for asking. So I took a 12-step route, and part of the 12-step was, there's a step 11 says, seeking conscious contact with God as you understand God. And that's also one of the beauty of being in a 12-step recovery program, because it says to find a concept that works for you. So it doesn't have to be whatever traditional thing, but what is it, this concept of higher power? And this is something that has become something very different for me as I've grown. But it said seeking conscious contact and asking for direction. So I started doing more of that. I knew how to pray very well, but I didn't know how to meditate. The prayer was always, asking for this, but I didn't know how to sit and to be still. And I happened to go one time to work to study and do some work in the US for the organization I was working for, and a friend took me to this Step 11 meditation meeting in a Buddhist temple, and I just loved the experience of sitting there quietly and just being quiet, just being still, just watching my breath. And so I started following that and practicing that. And then I came to find out that actually a lot of ancient faith traditions, they do have this quietness, this meditation practice. Even the origin, my original faith belief, actually in the early days, they did have those practices of people just being still, just being quiet, and just being there, not asking for anything, not going anywhere, but just being still, just being quiet. And so I started exploring that, and I just loved how I felt that I could just observe my feelings, that they were coming and they're going. I didn't have to act on them. I could observe my thoughts. I was not my thoughts. That seemed so liberating for me, because everything had always been like a compulsion. If I feel this, I've got to do this. If this thought comes, I've got to, but no, I can just, observe, just let them go. And then so I started studying, and I found this Palouse Mindfulness MBSR course online. I downloaded all those things, and I made a fat booklet, and I just went through that training. And then I got certified as a mindfulness-based intervention teacher, because I realized that I wanted to share this with others, but if I didn't know how to share it properly, I could hurt others, and I didn't want to hurt anybody or to create any harm. And then, of course, along the way, I found, or Misa found me, I should say. got to meet Janine, I think, and Linda, and is it the Dalai Lama thing in Gaborone some years ago, and they told me about this wonderful training that they had. So then I got to meet my Sangha here in South Africa, and yeah, meanwhile, I also got trained in other ways. So this has become now what is part of my life now, a very, very integral part of my life, my mindfulness in everything.
That's wonderful. That's wonderful. Step 11, yes, in the 12-step program calls us to maintain conscious contact with a power greater than ourselves through the practice of meditation and prayer. What I found interesting was when you talked about sitting still, and it provokes the idea that for most of us, it wasn't physical stillness. It was our monkey brain that was always going 100 miles an hour. So did you feel that overactive imagination, overactive overthinking was tamed? Did you feel that sitting in silence actually helped your thought patterns early on, even before you started learning about mindfulness? Was it the mere sitting? Was that an instinctive reaction on your part?
Yeah, yes, just sitting, being still, yeah, just being able to observe the quiet mind. Yes, yeah, that's what happened. And I think an important thing to also point out is that for me, my journey, my higher power does not reside outside me. My higher power is a divine intelligence that I have in me. And I think every human being has got in them this divine intelligence and wisdom that for me was obscured by my anxieties, my worries, my fears. So I could not tap into my innate wisdom. So it's not just something I've got to look outside of myself. It is within me, and it's with anybody. When I'm still, I can tap into that. When I'm disturbed, I lose access to that, so to speak.
Wonderful. Contemplative practices in and of themselves are amazingly impactful. So,
Sorry, I think that it's maybe time for us to wind up so that we've got space for Samba to continue with her little presentation. Is there anything else you were needing to say?
Well, I was going to ask Samba if she wouldn't mind sharing with us how she's integrating mindfulness in her daily life, in the work that she does, this holistic approach based on nature, based on preventive medicine. Is mindfulness a strong part of what you're doing in your day-to-day life?
Yeah, thanks for that. And I guess I'll talk more about my work in the next presentation. But for my own self, yes, mindfulness, there's the informal practices, the formal practices. But in terms of formal practices, sitting down on the cushion is something I need to do every day. I cannot leave home without it. No matter how rushed I am or whatever, I've got to sit down and just take a short time to do just kind as any kind of practice. And that really makes such a difference. And of course, trying to find micro moments during the day if I can to be able to do that, but especially every morning, sitting before I leave the house. Don't leave home without it. And just integrating it in my everyday life, in my clinical practice, as I'll talk about when I'm talking in the next presentation. So it just helps me to be present and to be there for life and to observe my mind, my reactions, my whatever. Yeah. Thank you.
Thank you very much.
It doesn't always show.
Thank you for
Thank
sharing.
you. Thank you, Elizabeth, for the skillful and sensitive way that you conducted this conversation together. And Samba, a really deep bow to you for the courage to speak so openly and beautifully. But I'll hand over to you now, Samba, as you continue with the presentation.
Yeah, thank you, Elizabeth. Thank you, Janine. So if I just can share my screen. Okay. There we go. Where am I? Zoom. I'll share screen. Okay. Oopsie. And slideshow. Okay. All right, slideshow. Can you see everybody? Can you see my presentation? Yeah, it's fine. Right. Okay, thank you. So yeah, I'm Samba, and I'm a certified International Board of Lifestyle Medicine. I'm also a behavior change facilitator, and I have the IMISA postgraduate certification in MBIs, and I offer service from Sarai Holistic Care in Francistown, and those are our websites. And I also happen to be the founding chair of the Botswana Association of Lifestyle Medicine. Okay, so I'd just like to share about, so just as a disclaimer, that these are apps that I work with, that were developed by Dr. Judd Brewer, who is a neuroscience and an addiction psychiatrist. And I just found it would be useful to share the concepts that these apps use, because I found them very useful, not just because I'm supporting people who are using them, but you're just taking these same principles and concepts and working them with the people that I serve in my clinic. And basically, it's just to go back a little bit to what Pete was sharing beautifully about how we form behaviors, is that we could just basically think there could be a trigger, a behavior, and a result. And to change our habits, we need to know how our mind works, how our habits are formed. And I think it's important to remember that habits are important for us. The habits free up the mind so that we don't have to get up every morning and think, how do I walk? How do I brush my teeth? How do I whatever? They become mental habits because they help, they free up the brain to do other good things. It's just that in time, what might once have been a useful habit may now start to harm us. But before we can change a habit, it's important for us to understand what actually may be driving that habit. So the trigger or the cue is what could start the habit. Maybe it can be something we see or a place we visit, or just a thought, emotion, or a physical sensation. And the behavior is the habit itself. So it could be like a physical behavior way of like biting our nails for too long, or being on social media. And it can also be a mental behavior like worrying a lot, or self-judgment, or just being filled with a lot of anxiety. And the result is how we feel after the behavior. In the short term, this might feel a bit of a relief, but in the long term, perhaps not as much. So this is a graph that can even be downloaded from the website, drjudd.com, Map My Habit, where if we just print it out, we can just describe what we want to change, what actually we get from that behavior, and what we think might be triggering it. Sometimes we don't know the trigger, but we do know we're caught up in a certain behavior. And that's good enough if we can just now examine what do we get from actually acting out that behavior. So these apps that have been developed by Dr. Judd Brewer and are now being owned by Share Care. They're app-based behavior change programs. There's the unwinding anxiety, especially for people who are dealing with a lot of anxiety, experiencing a lot of anxiety, like I was. Then there is Eat Right Now, which is especially for people who may be experiencing struggles around eating, overeating, binge eating, etc. And then there's Craving to Quit for those who are wanting to cease to use tobacco products, vaping, etc. And these are some books that he has written that talk to these habits. And the data, this is a little bit of the data from these apps. The studies have found that mindfulness training outperforms cognitive therapy. The reference will be there in the ones that they used when they used in these apps. Helping people to quit smoking and target specific neural pathways for its effects. So there are some references which you'll be able to see in the slides. And then this is another study found that a 40% reduction in craving-related eating with the app-based mindfulness program Eat Right Now, which is now also being used as a diabetes prevention program in some parts. Then study of the app-based mindfulness training for anxiety Unwinding Anxiety demonstrated a 57% reduction in generalized anxiety disorder scores in anxious physicians. They did a pilot in anxious physicians, and they found that just by them using these apps and mapping their habits, they could also actually reduce their scores. And a randomized trial of the same program showed a 67% reduction in GAD scores in people diagnosed with generalized anxiety disorders. And these are some results from the diabetes prevention program that among the diabetes prevention program members who began during this period, January, February 2023, 55% of the members lost or maintained their weight. So they didn't gain, but they lost or maintained some weight, and 4.6% average weight loss, and 29.1% maximum weight loss, which is really good if we're wanting to prevent diabetes in people who may be at risk for developing diabetes. And 19% of the members achieved at least 5% weight loss. Okay, and I'd also like to share about this mind shift recovery, because those other ones, let me just go back a bit, sorry. Oopsie, sorry. Oh, sorry. Oh, sorry, that's me. Sorry, I made a bit of a mistake there. I didn't mean to go back there. I meant to do this. Thanks for bearing. Okay, thanks for bearing with me. Okay, this mind shift recovery, this one is a free app, and it's they have a web app, and then they've also got this one that you can download to your phone. And really, I would recommend just to check it out, because this one is for free. The other ones need subscription. And basically, it says why it's not your fault. Our brains are wired to seek comfort and avoid discomfort, whether you struggle with substances like drug or alcohol, digital addictions like online gambling, or compulsive social media use, or other problematic behaviors. We can help you work with your brain to help you break the cycle and reclaim your life without shame or judgment. So this is a free app, and they have free online meetings. And as Dr. Brewer wrote, and this is an article published in the American College of Lifestyle Medicine journal, Avoidance of Risky Substance Use. He said current approaches to obesity, anxiety, and other behaviors that are driven by reinforcement learning, for example, smoking, may not be taking into account well-established theoretical models. Novel approaches that specifically target those mechanisms through using awareness to update the reward value of behaviors show promise, as in mindfulness training, which may help the field move away from willpower and cognitive control-based interventions that currently predominate. So like, telling people just calorie restriction, just eat less. If we can bring in mindfulness. My lab has found direct correlations between anxiety and physician burnout. Understanding the basics of how this process works can give clinicians simple tools to not only reduce their own stress and anxiety, but also to improve their relationships with their patients and to improve patient outcomes more broadly. A physician who has used these methods to manage his or her own stress may be able to counsel patients more effectively from a position of authenticity and wisdom, beyond simply recommending that one follow standard guide. And I think we've all experienced that when we have experienced something and we are sharing with our clients or our patients, they know that is something from our own experience, as to oppose when we're just trying to get rid of them by sending them somewhere else to something we've never maybe really tried. So, and as also since we are a lot of clinicians here of sorts, I would also like to talk to you about this free app, which the Unwinding by Share Care. It has got this special module that I also helped to pilot. It's called From Burnout to Resilience, New Mini Course for Clinicians. So the burnout has become too common in the healthcare field, from empathy, fatigue, and self-judgment to uncertainty and anxiety. Being a healthcare professional can feel heavy. And so this is a mini course that you can just try out, and it just shows us how to be aware of how we may be getting drowned in our patients or our clients' struggles and pain, but how to be able to be present and not be drowned in them. Okay, and then last but not least, I need to, as a lifestyle medicine doctor, to talk to you about dreams. So I know that we are all different kind of providers, and we see people in different scenarios. But I'd just like to invite us to consider also looking at other aspects that people with addictions, who are living with addictions, other aspects of their lives that it can be helpful to explore even as we are working with them. So there is evidence from these 6 pillars of lifestyle medicine, DREAMS, DREMS, which is an easy way to remember the 6 pillars, that a diet that is predominantly whole plants as a source of energy does a lot to help with the overall mental health as well as the cravings, etc. There's this Infinite study. They did a pilot research exploring plant-based nutrition in treatment of substance use disorders. And they found that they were the people who were given the predominant whole plant-based diet, they did better compared to those who were being given standard rehab diet. I don't know if anybody knows what rehab diet is like, but it's usually there's a lot of sugar and coffee and chocolates and all these things that, as long as you're not drinking or using, all those other things. And they I think from what Peter said, with showing us how the brain is, I think some of those things we can see how they would just be, maybe not as helpful when we ingest them. And then there's also the Food and Mood Center from Australia that can be a resource to look up and to help people who are struggling with substance use disorders. Looking for relationships that are positive, social connections in Ubuntu. Many times people living with addictions have become broken relationships, and people no longer, or they are feeling very isolated, etc. So the importance of maintaining positive social relationships, whether it's part of rebuilding relationships in the community, volunteering, whatever, but to stress that these are also things to be looked into even as we are working with them to help them stop using the drug or whatever substances. There is also the importance of exercise is being documented, especially where there's also a lot of anxiety, how also having some kind of moderate activity is very helpful, working with people who are using substances. And we're talking here about avoidance of risky substance use. And then there's the mental health and medical checks. So look to, okay, there's prolonged negative stress, trauma, attend to other coexisting medical conditions with referrals is indicated. Sorry about those typos, because many times people may be having other medical problems that are also making their substance use worse and make it harder for them to feel normal and to be normal. So at least just talking about those things and making sure they do get this can help us to be more effective in our treatment. Sleep that is restorative. Many times when we're using substances, we have very distorted, fragmented sleep, and that is so important for our overall health and our well-being. And if you are stuck with such things, don't worry. There's a South African Lifestyle Medicine Association in South Africa, and there's their website. Please find a certified health professional that you might refer some of these people to, so that they can get all these other elements of their lifestyle supported as well. So, okay. And now, if it's okay, I'd like to offer us a short practice from from one of the from these tools. So basically, the tools, these behavior change apps, Dr. Brewer talks of this using gears, the gears concepts. So he talks about being in reverse gear when we're just caught in a habit and we're in automatic pilot, as we would call it in mindfulness. And then there's a first gear when we wake up that we are in a habit, we are caught in a habit, we are once again doing that thing. So I've just woken up that, okay, I'm once again going and opening the fridge when I'm not hungry and I'm reaching for, I don't know, those dates or whatever. But I haven't changed my behavior. I'm just doing it. If maybe I've got an overeating problem. or overeating challenge. And then the second gear is now when I sit and examine what is it that's going on with this habit. Not so much what's wrong with me or whatever, but what is it that I'm getting from here? So just getting in touch with my body and being aware of what it is. And maybe I'm going to get some brief relief if I'm feeling a bit lonely and tired from eating that. But what do I get down the line as well? So this is how we use the gears to help us to step out of the habits so that we're actually sitting with our lived experience when we carry out that habit. So I'd like to invite you now, if you care to just take a moment to find a comfortable position, whatever it is that works for you, whether you're just sitting, lying down, standing, whatever it is that works for you at this moment. And maybe taking 1 or 2 deep breaths to just center. And if the breath is not working to help you center, just bringing some awareness maybe to your hands, your feet, whatever it is that can act as an anchor in this moment. So being here now. Now, gently bring to mind, if you care to, a habit you might like to work with. Without judgment, whatever it is, whether it might be some kind of food that you find yourself picking up and eating over and over again, or some kind of worry, planning, whatever habit. Just bring it gently to mind, and perhaps remember the last time you acted out that habit, the last time it was acted out. Okay, and just now dropping into the body, just being aware what it is that's going on there now in the body. Or what are you feeling? Just so you've got this habit in mind and you're aware that you've been caught in the habit the last time. Just bringing now some gentle curiosity of what's really going on. What are you feeling? Are there sensations associated with it? Some thoughts? How does it actually play out? Might there be some brief initial relief? A feeling of release? And then what happens after? Is there a contraction? What are the thoughts that prevail? And what is it be like with the K for the kindness to just look at yourself with kindness? Maybe this is something I struggle with. Can I just be kind to myself? Maybe put a hand on the heart and just acknowledge that it is hard. What do I really need at this moment? What would nourish me? What would sustain me? And when you're ready, just feel free to come back into the meeting. Thank you. So may I leave you with this meditation. May we find stillness in the midst of chaos. May we be at ease in the midst of discomfort. May we be safe and well in the midst of uncertainty. May we live with kindness in the midst of all that is difficult. May we find joy in the ordinary and the mundane. Thank you so much. These are resources that you can check out. You'll find them on the website of the Institute for Mindfulness South Africa, or know about the MBSR free mindfulness course that I followed that helped me, and the Habit Change Made Simple with the free to download. And then this is the free app that I talked about. And yeah, thank you. Thanks again.
Wonderful. Thank you so much, Samba, and thank you all for such a rich presentation. I'm sure many of you have got questions, so if you have, just put up your hand, or you may want to write a question in the chat. So who would like to ask a question? Or maybe I'll start since we're waiting. I'm just so curious, we were talking a lot around the addictions that we think of previously with substance abuse, etc. But I would guess that one of the addictions we're going to be spending most of our working lives with now is really around digital devices and all that which is available on digital devices. And I'm wondering, Pete, if there's much research around that, because it sort of just feels as if it's so much more accessible. When Samba says, "What do you do when you wake up?" and then I thought, "Oh dear, this," which isn't, what I would really choose to do, perhaps.
Yeah, thanks, Janine. You're absolutely right. So addiction to digital media is a huge issue, and I'm sure many of us are familiar with the work of people like Jonathan Haidt. I'm sure many of you will have come across his book on the anxious generation, where he documents very clearly the effects of digital media on children and adolescents, and talks about the importance of protecting our children. So I think this is vital not just for us as adults, but for our children and for those involved in parenting. And we're seeing a very interesting process happening around the world now around regulating access to digital media for children and adolescents. The South African Society of Psychiatrists has just published a position statement on this, echoing our concerns about the effect of digital media. So it's a huge issue. Interestingly, there's only one mental disorder in the DSM, and that's in the appendix, and that's internet gaming disorder. But I suspect it won't be long before there are others added into the category of formal diagnoses in this area. But I think the important thing is that the pathways are the same and similar, and that the processes in helping people with addiction, whether it's to social media or other things, are very similar. So I think that's what we've tried to do, and I think what Samba's illustrated in her input as well, that one can use similar approaches to whatever the addiction is, and certainly this is one that is a real challenge. Let me pause there. Thank you.
Thanks, Pete. Michael?
Good evening, everyone. Thank you, everyone, for your wisdom and knowledge that you've shared. So I wonder if I could just take a moment just to share a little bit about my sobriety journey and how mindfulness played such a big role in just getting me through day by day. So on the 9th of March this year, I was celebrated 14 years of sobriety, and although each day is a celebration for me, looking back at that decision I took back then, but there's something that is so strongly within me about my recovery, and specifically how mindfulness played a big role, and that's the beautiful, powerful lessons that I learned that perhaps one would never learn if you haven't come from an addiction struggle. And I want to just bring in one or two of them. The one is that at this outset, I said to myself, basically what I've been doing is running away from what's within, avoiding, running, escaping. And so there was something in me the day that I took that decision that said, you've got to now do the opposite. And the opposite, and I didn't even know what mindfulness meant at that time, but the opposite was being with what was within me. So that's how it started. That's how I started my journey with mindfulness. But one of the biggest and first lessons that I learned, and I think it sits with me every day, is that I came to a realization that my behavior up to that point, and every behavior, had an underlying reasons, even if they were unknown. And particularly for me, I was able to say, hang on, I have a struggle with alcohol abuse. I grew up in a home where there was alcohol abuse. My little farming village that I lived in, everybody drank heavily. It was a culture where if you did not drink, or you drank moderately, you were mocked or shamed. So that was the environment I grew up with. You were praised if you could drink like a whole case of beer or something. So I got to the point where I was able to say, look, there's reason for the path that I took, and that opened just a little door for compassion for myself to say, okay, I can soften that guilt and shame a little, and give myself a bit of a break in terms of how come I went down this destructive path. So, and that lesson I now use for any behavior or any unwanted thoughts or emotion. I say, look, there's reason, So you didn't speak your truth in that meeting or whatever, but there was reason. Maybe you were not feeling confident. So I use it all the time. And some of the other things that I think that come out from an addiction recovery journey that you possibly wouldn't uncover for yourself if it wasn't for that is there's a very strong need to go on a I went on a quite a significant forgiveness crusade where I needed to get hold of people that I felt that I had harmed or had hurt in some way, and really difficult thing to do. But through that concept of mindfulness and being with what I was feeling, I was able to step through that, and and that is now stayed with me, you know. So I don't find forgiveness a difficult task anymore. So wonderful, wonderful positive outcome from that journey. And being able to sit with guilt and shame and not run from it, you know, because, you know, regardless of addiction or not, we are going to have many, many instances where there's guilt and shame, and to be able to just be with that without adding a layer of criticism and being hard on ourselves. And then the one thing that I think that, because I know that some of you mentioned about your parents and you didn't blame your parents, the one of the biggest things that I learned through my journey was to be able to, in a kind and compassionate way, because that's at the heart of mindfulness, was to approach those who had done me harm and who had not been there for me when I was a child, perhaps to show me a different way of being. So I had to try and release that anger. So I acted on that and approached parents and others and said, look, you know, I respect you, and I know that you did what you could given the circumstances, but these are the things that I'm carrying from those times, and I need to process this so that I can let go. So coming out of the journey, I just feel like that there's a positive, powerful whole string of lessons that we can explore through an addiction recovery journey, particularly if mindfulness is the support structure for that.
Yeah, thanks so much, Michael, and thanks also for your courage to be so open and honest. Samba, I can hear quite a lot of that is very similar to your journey. So I wonder whether you and Elizabeth want to say anything or to reflect on Michael's story.
Elizabeth, would you like to go first?
Yeah, it might help if I unmute, right? Yeah, thank you so much, Michael, for that really profound share. It is, yeah, it isn't an easy thing to confront, you know, past actions or omissions, whether from ourselves or from the caregivers. As you rightly said, they did the best they could with what they had. And so that brings in compassion, which is an integral part of mindfulness, to feel compassion for them and for ourselves too in the process. So making amends is, yeah, facing the reality, having the courage to change the things we can. In other words, not rewriting history necessarily, that's not what I'm getting at, but to change those feelings, those resentments and anger and frustration points to one of the most important aspects of mindfulness, which is not living in the past. You know, free yourself, that liberation that comes from being present now, today, in this moment, and letting go of the past. But it is a journey. It is a difficult journey, but having the willingness to embark on that is absolutely crucial. So I applaud you. I salute you, Michael. Thanks so much for sharing.
Yeah, well done, Michael. Thank you for sharing that. And yet, so true, the freedom comes thanks to mindfulness and being present. Moment awareness is, I don't have to live in the past. it's what happened. And the important point you raised, the self-compassion, Mike, thank you for that reminder, because I think that's another of the most important things I have found, to be able to be patient and forgiving of myself, that, I probably was just doing the best that I could with what I had at that moment. And even today, I realize that I'm much more patient with myself, and I'm much more patient with others as well. Not so much that I let myself off the hip, but I just recognize that, okay, this is hard. I say, this is hard. This is hard, Samba, just let it go. So I speak kindly to myself. I don't call myself negative names. And I actually cringe when I hear people calling themselves stupid person, whatever. It's just not in my vocabulary. So just being gentle and patient with myself is, really one of those great gifts. And being gentle and patient with those around me. There are people, they may never realize, they may never change, but that's them and it's me. So what is it that I need to do to take care of myself and to still be compassionate and to still be there without letting other people's stuff affect my own peace of mind? Thank you.
Just to add on to that, if I may, a saying that, our alcoholic minds are very dangerous places to go to on our own, and being vigilant and reaching out for help, checking our thought processes, because, we're not bad people. We're just simply sick. We're sick people, not bad people. And that's part of the compassion practice that can be helpful to us. So speaking to a sponsor, speaking to an accountability partner, cross-checking, what is the motive? What is the motivation for the way I'm behaving, the way I'm acting? What is it exactly? What is it based on? So probably there's some more questions coming up as well, if we have the time, Janine.
I see that we actually are nearing 9 o'clock. I don't know if anybody else has a question. But otherwise, I think that you guys have summed it up really beautifully. It reminded me of the quote from Annie Lamott, where she said, "My mind is like a bad neighborhood. I try not to go there alone."
Exactly.
And so I think there's actually something about that's so wonderful about us just being able to come together in community and to be able to share knowledge and to share our stories together. And yet again, a very deep bow to Pete for your presentation, and to our sisters in Africa, Samba and Elizabeth. It's been really wonderful having you join us and to be part of this this learning forum of us all together. So thank you very much. Thanks. And thank you all for joining us. This will hopefully soon be available up on the MISA website.